Good afternoon, dear students. I am Dr. Saqib Ahmad. Our today's discussion will be the radiology of tuberculosis. As we know, the tuberculosis is still the most common disease as far as our cities or our country is concerned. So, and at the same time, we also know that tuberculosis can involve any part of human body. So we'll discuss it in two segments, part 1 and part 2. So we can see with elaboration that how the tuberculosis involves the different organs and structures of our body, and what are the radiological investigations which we perform to reach the diagnosis. So the part 1, radiology of tuberculosis. First of all, the most common presentation of tuberculosis is the pulmonary tuberculosis. Pulmonary tuberculosis can be divided into primary and post-primary tuberculosis, and most common in the infants and children, now increasingly encountered in adults, and today it's 20 to 34% of all the adult tuberculosis cases. Typical radiological manifestations of primary pulmonary tuberculosis are: number 1, parenchymal disease, lymph node enlargement, pleural effusion, miliary spread or miliary disease, or segmental or lobar atelectasis. Actually, these are the findings of the primary pulmonary tuberculosis, which can be seen on different radiological investigations. The most commonly advised radiological investigation is still the X-ray chest for the suspected pulmonary tuberculosis cases, but the results of the chest radiograph may be normal in up to 15% of the cases, where we cannot find any trace of the disease. Now this is a typical X-ray. Consolidation in primary pulmonary tuberculosis. Frontal chest radiograph demonstrates consolidation in the right middle lobe, depicted by the straight arrow with irregular hilar lymphadenopathy, and this is depicted by the curved arrow. Now axial scan through the chest of a patient. In this you will see there is pleural effusion. This is axial contrast enhanced CT, which demonstrates a large right-sided pleural effusion. The enhanced parietal pleura is uniformly thickened, depicted by the thick arrows. Another CT, axial view. In this case, the pulmonary parenchymal changes and lymphadenopathy in the primary tuberculosis. Axial contrast enhanced CT shows the pleural enhancement, pleural thickening, cavitations, and lymphadenopathy with the curved arrows. Now this is the case where there is massive mediastinal lymphadenopathy depicted by the arrows. Axial contrast enhanced CT scan demonstrates multiple enlarged mediastinal lymph node with central areas of low attenuation and peripheral enhancement. Miliary tuberculosis. Sometimes it's become very hard to find the fine miliary nodules in the chest radiograph, but however, if you look carefully in this picture, you will see fine nodular pattern in the lung fields. It is very well depicted in the high resolution HR or HRCT of the chest. Here you see the lung fields are studded with fine nodular lesions And this is biliary tuberculosis. High resolution CT scan obtained with the lung windows demonstrates numerous fine discrete nodules bilaterally in a random distribution. So this is a case of miliary spread of pulmonary tuberculosis. Now we come to the post-primary tuberculosis. Earliest radiological signs of post-primary tuberculosis include unilateral or bilateral ill-defined patchy segmental consolidations with predilection for the apical and the posterior segments of the upper lobes. Late manifestations of the post-primary tuberculosis: number 1, cavitations; number 2, lung parenchymal destruction; number 3, fibroproliferative changes; number 4, bronchiectasis, and this bronchiectasis actually traction bronchiectasis due to the presence of the pulmonary fibrosis. Fifth is the endobronchial, endotracheal or endobronchial spread. 6, cavitations with aspergillomas and lymphadenitis. Now these are the late manifestations of the post-primary tuberculosis. Here you see an axial CT chest with large cavitary lesions. Post-primary tuberculosis case, axial contrast enhanced CT obtained with mediastinal window demonstrates an enlarged mediastinal lymph node with a central area of low attenuation. And posteriorly you will see a thick walled cavity. So lymph node enlargement, lymphadenitis as well as cavitary lesion. Another demonstration of post-primary tuberculosis: severe lung destruction. Axial CT demonstrates a fibrotic, shrunken left lung with compensatory overinflation or overexpansion of the right lung, extending across the midline. Bronchiectatic changes are noted bilaterally, arrows. These are the traction bronchiectasis due to the presence of the fibrosis. Now this is a case of post-primary presentation is fibroproliferative disease. Frontal chest radiograph shows clumped nodular and linear areas of increased opacity in both upper lobes and in the right middle lobe. White arrow. There is accompanying volume loss in the right upper lobe as well as overlying apical pleural thickening with the black arrow. Another picture, CT scan, axial view. This is a fibroproliferative disease. Axial CT scan demonstrates bilateral, diffuse, coarse, linear and nodular areas of increased attenuation and cavitations depicted by the arrows. Bronchiectasis, post-primary tuberculosis. Axial CT scan demonstrates bronchiectasis in the left lung, arrow, with areas of emphysema. Now whenever there is fibrosis, there is compensatory hyperinflation, and it gives a picture of emphysema and emphysemated expansion of the remaining lungs. The arrow demonstrates fibrosis with areas of traction bronchiectasis. Typical chest radiograph demonstrates cavitary tuberculosis associated with aspergilloma. Frontal radiograph shows a cavity in the left upper lobe, black arrow, with a dependent area of soft tissue opacity, solid white arrow. The crescentic area of the hyperlucency, open arrow, represents the residual air in the cavity and is referred to as the air crescent sign. The same patient, axial CT was performed, and here you can see the things more clearly. Cavitary tuberculosis associated with aspergilloma. Axial CT scan shows dependent soft tissue aspergilloma black arrow within the cavity, solid white arrow along with the air crescent sign, which is depicted by the open arrow. So here you can see the axial CT scan of the same patient where you have the previous chest radiograph. The things are much more clear in CT scan. Endobronchial spread of the tuberculosis. Axial CT scan shows severe changes of the bronchiolar dilatation and impaction, bronchiolar wall thickening, straight arrow, and the mucoid impaction of the contiguous branching bronchioles produce a tree in the bud appearance. This is depicted by curved arrow. So this is a case of endobronchial spread of the tuberculosis. Tuberculosis can lead to the bronchostenosis due to the chronic inflammatory process, persistent changes. Axial CT scan demonstrates narrowing of the right main bronchus depicted by a black arrow. Now the next system of the body which is involved by tuberculosis is the gastrointestinal tuberculosis. Common manifestations: number 1, ileocecal; number 2, peritoneal; number 3, mesenteric lymphadenitis. And peritoneal tuberculosis has 3 types: A, wet type; B, dry plastic type; and C, fibrotic fixed type. Barium study: ileocecal tuberculosis, radiograph obtained with per-oral pneumocolon technique. This is also called double contrast technique. Demonstrate a clinical and shrunken cecum with the straight arrow, retracted out of the iliac fossa by contraction of the mesocolon. Note also the narrowing of the terminal ileum depicted by the curved arrow. So the tuberculosis very commonly involves the ileocecal area, where it may lead to fibrosis, constriction, and intermittent dilatation. So all these are the findings of the involvement of the ileocecal region by the tuberculosis. This is a CT after oral contrast. Ileocecal tuberculosis axial CT scan demonstrates concentric cecal wall thickening depicted by the arrow. You can see the contrast inside the very small lumen where the walls of the cecum are moderately thickened. Yet another case of ileocecal tuberculosis and peritoneal tuberculosis wet type. Axial CT scan demonstrate concentric thickening of the cecum depicted by a straight solid arrow, small bowel dilatation, curved arrow. This is due to the narrowing, stenosis, and fibrosis. Ascites in the greater peritoneal space and thickening of the peritoneum, open arrow, also seen there. Another case of ileocecal tuberculosis axial CT scan obtained ordered to demonstrate diffuse thickening of the terminal ileum. Now this is abdominal tuberculous lymphadenopathy, lymphadenitis. Axial contrast enhanced CT scan demonstrates multiple and large mesenteric lymph nodes with central areas of low attenuation and peripheral enhancement. This is because of the central necrosis of the matted and large mesenteric lymph nodes. Now this is peritoneal tuberculosis, dry type. Axial CT scan demonstrate thickening and infiltration of the peritoneum, white arrows, along with thickening of the bowel loops. Note the small amount of the loculated fluid, black arrow. Peritoneal tuberculosis, this is fibrotic type. Axial contrast enhanced CT demonstrates enhancing thickened peritoneal straight arrows with an adjoining matted loops of the small bowel, curved arrow. Now we end this part of the tuberculosis, and today's assignment is what is the radiological difference between the primary and the post-primary pulmonary tuberculosis. You can answer these questions and by marking your attendance on either Facebook or on the YouTube. I'll send you my email address. Thank you. Goodbye.